the number of people with diabetes is skyrocketing. It's estimated that by 2020, close to 1 in 3 Canadians will be living with either prediabetes or diabetes. These patients are seen frequently in pharmacy practice, so all pharmacists must be comfortable discussing and managing common issues. Self-monitoring of blood glucose, or SMBG, is an important tool for ensuring optimal glycemic control and reducing the risk of complications, and is a valuable educational tool that can help your patients self-manage their diabetes. These benefits will only be realized when the patient is using this tool correctly and appropriately. So, how can pharmacists maximize the benefits of SMBG in their patients? Here are some tips. Tip 1. Provide them with their targets and testing times. Testing just for the sake of testing or recording a number in a logbook is of little value to your patients. Patients should know the recommended targets for SMBG. So for most patients, it's between 4 to 7 millimoles per liter fasting or pre-meal and less than 10 2 hours after meal. If the patient is not meeting their A1C targets, the 2-hour target after a meal is less than 8. Check your patient testing time, as they are often not testing appropriate times, such as right after eating. Tip number 2, recommended testing frequency and when to adjust it. Far too often you'll open up a patient's logbook and see a single test every morning before breakfast. Many of these patients do not use these test results to change any aspect of their diabetes management. We should be providing patients with a testing frequency based on the current Canadian Diabetes Association clinical practice guidelines. Remember, it's important to adjust these frequencies based on the needs of the patient. If the patient is not reaching glycemic targets or is experiencing episodes of hypoglycemia, illness, stress, or starting a new medication, or is newly diagnosed, we should increase the SMBG testing frequency. If they're reaching glycemic targets, well, we can consider decreasing the frequency as well. SMBG, like everything in diabetes, should not be static and should be adjusted based on the needs of the patient. Tip number 3, know your guideline recommended testing frequency. Some patients are not testing as often as recommended by the guidelines. Any patient using insulin therapy should be testing at least as often as they administer insulin. For example, a patient taking 2 injections of insulin per day should test at least twice per day. Tip 4, look for patterns. You do not have to be a certified diabetes educator to notice patterns with SMBG testing. Many patients apply too much emphasis on 1 or 2 readings that are high and outside of the target range. By helping them to identify these specific patterns, we can educate patients on how to self-manage these readings, adapt or change their therapy, and discuss how these patterns impact overall glycemic control. Tip 5. Remember, A1C and SMBG complement each other. Some patients may question the need for doing both A1C and SMBG testing. A high A1C reading tells us we have to make a change. Using this with SMBG data tells us the best change, either lifestyle, medication, or both, to make. Also, there are conditions like anemia, chronic renal disease, or hepatic disease that can affect the patient's A1C value. Last tip, ensure proper diabetes management for both your patient and the pharmacy. Patients with diabetes are important clients for most community pharmacies. They are usually on multiple medications and purchase a large amount of supplies from the local pharmacy. By helping your patients manage their diabetes with tools such as SMBG, you are showcasing your role in helping your patients self-manage their condition. By working collaboratively with these patients, you can ensure their loyalty to the pharmacy, but most importantly, improve their health and reduce their risk of diabetic complications.